Okay, now it's time to talk about an osmotic diuretic, mannitol. Let's talk about mannitol. A 34-year-old male presents to the ER after having been involved in a massive motor vehicle accident. The patient is unconscious and physical examination reveals bilateral papilledema, bilaterally dilated pupils, bradycardia, and an irregular respiratory rate. You immediately become concerned that this patient may have a serious head injury which is now causing increased intracranial pressure. After calling for the neurosurgeon, you attempt to decrease the patient's intracranial pressure by hyperventilating the patient and by trying to reduce the patient's effective circulatory volume with a medication that acts as an osmotic diuretic. So that is mannitol. So other osmotic diuretics include urea, glycerin, and isosorbide. So the mechanism of action of mannitol is it acts on the proximal tubule of the descending limb of the loop of Henle of the nephron to increase tubular osmolarity, thereby drawing water into the tubular lumen. The net effect of mannitol is to increase urine outflow and decrease the effective circulating volume in the body. Clinical uses: decreasing intracranial and intraocular pressure by volume depletion. It can also be used to treat acute renal failure and to prevent the development of acute renal failure following toxin exposure, trauma, or shock. Side effects: GI upset, headache, and dehydration. The use of mannitol is contraindicated in patients with congestive heart failure, as it can lead to pulmonary edema by initially causing an expansion of the effective circulating volume before renal elimination. Isosorbide and glycerin are used only for ophthalmologic procedures. So mannitol, similar to urea, glycerin, and isosorbide, osmotic diuretic, proximal tubule of the descending limb of loop of Henle, used for the decreasing intracranial and intraocular pressure.